85% of people experience low back pain at some point in their life. What's really alarming is that there's an 82% recurrence rate. Now there are two main reasons for this. First up, it actually takes 18 months for the disc tissue to heal. You know when you cut your arm and within a week the skin heals over? Well, it takes 18 months for the same thing to happen to your disc. Unfortunately, you can't wrap yourself up in a bubble for 18 months while the disc heals itself. The other main reason is because when you have an episode of low back pain, you lose activation of two very important muscles that help stabilise your spine. Now these are automatic muscles. They should work just like breathing. You shouldn't have to think about it. But unless you retrain and re-engage those muscles, they'll never really come back. If you can just conceptualise, if this is your spine, you've got the disc in the middle. If these muscles aren't doing their job, your spine's just kind of shifting around like this all the time, and it's almost like it's almost just like it's picking a scab. It keeps getting irritated, and before you know it, bang, you've got another re-aggravation. Core stability is a term that gets thrown around a lot. Most people assume it's strong abs, and will do exercises such as sit-ups or planks to develop a strong core. My definition of core stability is the interaction of four muscles. On the top, you've got your diaphragm, which controls your breathing. On the bottom, you've got your pelvic floor, which regulates how you go to the toilet. On the back of your spine, going from segment to segment, you've got a muscle called multifidus. And then you've got this muscle that starts on your spine and wraps all the way around the front to the other side, called transverse abdominis. It's these two muscles, transverse abs and multifidus, that get inhibited when you hurt your back, and reactivation is critical to prevent re-aggravation. The University of Queensland did a landmark study in the 1990s which effectively changed the way low back pain has been treated ever since. They had two study groups. One had a history of low back pain, the other with no low back pain. They hooked subjects up with a whole heap of sensors, and all they got them to do was lift their arm. Now in the people with no low back pain, transverse abs and multifidus was switching on before the arm muscles. In the people with low back pain, there was no activation of transverse abs multifidus, or it was switching on after the deltoid muscles. This proved that transverse abs and multifidus are preparation muscles. They switch on to prepare the body for movement. Off the back of this study, the researchers dug deeper and determined that you need 1,000 activations of these muscles for the brain to even realise that there's a neural link. Your Back in Motion physio will teach you how to correctly activate these muscles using a real-time ultrasound machine. This allows us to visualise these muscles on a TV screen. Once you've got good activation, you need to develop endurance, and we'll recommend a course of clinical Pilates as part of your rehab.